Hello viewers, in this video we are going to discuss about um, the first aid measures for burns and scales. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. We will see the objectives of this video. At the end of the section, the viewers are able to define what is burns and what is scalds. List down the various types of burns, describe the first aid measures to be followed for burns, enumerate the prevention methods of burns. These are all the objectives of this video. Burns and scalds. Burns and scalds are damage to the skin usually caused by the heat, but both are treated in the same way only. A burn is caused by a dry heat, example an iron or fire. Scald is caused by something wet such as hot water or steam. Now we will discuss types of burns. Burns are assessed by how seriously the skin is damaged and the layers are affected. Based on that only we are assessing the severity of the burns and the types of burn. Your skin has three layers. The first layer is epidermis, the outer layer. Second one, dermis, the layer of tissue just beneath which contains the blood capillaries, nerves ending, sweat glands, and hair follicles. The next third layer is subcutaneous fat, the deeper layer of the fat under the tissues. Based on the layers damage only, we are able to assess the types of burns. There are four types of burns. Superficial or epidermal burn, where the epidermis is damaged and the skin will be red, slightly swollen and painful but not blister. That category comes under superficial epidermal burn. Second one is superficial dermal burn, where the epidermis and the part of the dermis are damaged. In this, the skin will be pale pink in color, painful, and there may be small blisters also. Third one, deep dermal or partial thickness burn, where the epidermis and the dermis are damaged. This type of burns makes your skin turn red and blotchy. The skin may be dry or moist and becomes swollen, blistered. It is very painful. Sometimes it affects the nerve endings. In that case, it is painless also. The fourth one is full thickness burn, where all the three layers of the skin, epidermis, dermis, and the subcutaneous fat, are damaged. That comes under full thickness burns. The skin is often burnt away, and the tissue underneath may be pale or blackened, and the remaining skin will be dry and white, brown, or black color with no blister. The texture of the skin may also be leathery and waxy. This may also be painless because the nerves endings and all damaged. So most of the cases, this type of burns, the patient not experiencing any kind of pain. Next, we are going to discuss one important thing. What are all the first aid measures or advices are there for treating the burns and scars? To treat the burns, immediately get the person away from the heat sources to stop the burning. Second one, remove any clothing or jewelry that near the burnt area of the skin, including the baby's nappies, but do not move anything that stuck to the skin. Okay, and cool the burn with the cool or lukewarm running water for 20 to 30 minutes. Do not use ice or iced water or any creams, greasy substance like butter because it aggravates the symptoms. Make sure the persons keep warm by using a blanket. For example, take it not to rub against the burnt area. After cooling the burn, cover the burns by placing a layer of cling film over it. Sometimes in our home, a clean plastic bag could also be used for burns on over the burns. Use painkillers such as paracetamol, ibuprofen to treat any pain. Rise the affected area if possible. This helps to reduce the swelling of the part. If it is an acid or chemical burn, dial the emergency number and carefully try to remove the chemical and any contaminated clothing. Rinse the affected area using as much clean water as possible. Usually, the mild form of burns that don't need any kind of medical attention. We will be able to treat that mild burns in the womb itself. It normally heals without any need of further treatment. While the skin heals, keep the area clean. Do not apply any creams or greasy substance. Do not burst any blisters, as this can lead to the infection. This is very important one. Do not burst the blisters. Okay, it lead to infection. If you have scalded the inside of your mouth by drinking some hot water or substance or things, try to avoid things that can irritate the scald area, such as hot and spicy foods, alcohol, smoking, until that area heals. Mild burns are scalds that only affect the supermost layer of the skin. So it usually heals in a week without any kind of treatment. When to get medical attention for burns? Depending on how serious your burn is, it may be possible to treat it at home. If it is in mild form, we can very well able to treat that burns in the home itself. But if it affects the second layer or third layer of the skin, we need to get medical attention. For minor burns, keep the burns clean and do not burst any blisters. More serious burns require the professional medical attention. You should go to a hospital admission and or emergency department for what are all the conditions. We will discuss that. All chemical and electrical burns, we need to go medical professional help. And large and deep burns, any burns bigger than the injured person's hand, we need to go medical help. Burns that cause white or charred skin, any signs, we need to go to the hospital. Burns on the face, neck, hands, feet, any joints or genital area burns, we need to go to the medical attention.
Now we will see when to get medical attention for burns. If someone has breathed in smoke or fumes, they should get medical attention immediately. And some of the symptoms may be delayed. That can include coughing, a sore throat, difficulty in breathing, facial burns. Those persons should get medical attention. People are greater risk from the effects of burns, such as children under 10 years old, should also get medical attention after your burns or scales. And the size and depth of the burns will be assessed, and the affected area cleaned before dressing is applied. And in severe cases, skin graft surgery may be recommended for the victims. Preventing burns and scalds. Many severe burns and scalds affect the babies and the young children's more. So these are some of the examples of things you can do to help to reduce the likelihood of your child getting serious accident at home. First one, keeping your child out of the kitchen whenever possible. Second, testing the temperature of bath water before you are putting using for your baby. Use for your elbow for bathing the baby under 5 children or the toddler, whoever it is. Keeping matches, lighters and light candles out of young children's sights and reach. Keeping hot drinks well away from the young children. Blisters. Blisters, we should not burst any blisters on your own self. If your burns has caused your blisters, you should get medical attention. If the blister remains intact, although some burns unit at hospital follow a policy of de-roofing the blisters. What is de-roofing? De-roofing means removing the top layer of the skin of the blisters. In some cases, a needle may be used to make a small hole in the blister for draining out the fluid from the blisters. This is known as aspiration. It may be carried out for the large blisters and where the blisters that are likely to burst. Healthcare professionals will advise you about the best way to care of your blisters and what type of dressing we supposed to done. How to prevent the burns in the kitchen area. It is best to keep your toddler out of the kitchen, well away from the kettle, saucepan, hot oven, doors, so that better to put one safety gate across the doorway to so that we can stop the children getting into the kitchen. Use a kettle with a short and curly cord to stop it hanging over the edge of the work surface. When cooking, use the rings at the back of the cooker and turn the saucepan handles towards the back so your child can't grab those items. By this, we can able to prevent the child to get burns or blisters. In bathroom, how we can prevent the burns? Never leave the child alone in the bath even for a moment, and fit the thermostatic mixing valve so that the bath hot tap to control the temperature. Put cold water into the bath first, then add the hot water. Use your elbow to test the temperature of the water before you put your baby or your toddler into the bath. Throughout our home, put your iron, air straighteners or curling tongs out of reach of the children, and fit the fire guards to all the fires under the heaters. Keep the matches, lighters and light candles out of reach of young children sights, so that we can prevent burns, because burns most commonly where the incident which classification is prone for burns, obviously children. So we are seeing in whatever the area we can prevent the children to prevent getting burns. Preventing sunburn. Encourage the child to play in the shaded areas like under the trees, especially between 11 a.m. to 3 p.m. when the sun is in a strongest phase. Keep babies under the age of 6 months out of direct sunlight, especially in the midday period. And cover your child up in loose baggy cotton cloths such as an oversized t-shirts with sleeves. Preventing sunburn. Tell them to wear a floppy hat with a wide brim so that shades cover the face and neck. Cover the exposed part of the skin with sunscreen even on cloudy or overcast days. Most sunscreen designed with the sun protection factors of between 30 and 50 and are effective against the ultraviolet rays also. Reapply the sunscreen after and throughout the day. Even water resistant sunscreen should be reapplied after you come out of the water. Till now we have discussed about what is burns, what are scalds, and what are all the types of burns and scalds, and how to prevent the burns and scalds in various settings like home, kitchen area and bathrooms, etc. I hope that you all able to understand what are the first aid measures we have to take for the burns and the scalds. Thank you viewers for your support.